I've farmed all my life. I drove a truck and worked 2 or 3 jobs. Been a good life for the grandkids and the kids.
We have 4 daughters, all have children, and 1 grandson and 9 granddaughters.
My left knee got arthritis and it was getting so I couldn't hardly bend it, and I couldn't keep up with my grandkids, so I got to do something. So Dr. Weber's gonna put a new knee replacement in on my left knee.
So he has end-stage osteoarthritis of his knee. We've tried multiple conservative things: physical therapy, anti-inflammatories, bracing, alteration of activities. He's a very active individual. He's here today to have a Mako assisted, which is a robotica arm assisted total knee arthroplasty.
Anything he does, it's a lot slower, takes a lot longer. He's hurting. He has hurt for a long time.
I think like 30 years ago, he had a knee scope, and they told him he was well on his way for a total knee then, and he just hasn't done anything. This is his first big surgery. He's nervous, anxious, but he can barely walk.
Well, just getting up and getting down, I mean, it hurts, and it's almost either want to sit or stand.
He did therapy this summer. We did a lot of things to try to avoid this. I don't think you want to do surgery if you don't have to. But I think this is probably the best, and I'm hoping he'll be a lot better.
Mako robotic arm assisted technology is a newer progressive type of technology where it really takes the human error out of the cuts and the procedure itself. It doesn't do anything that we don't normally do. We do our normal approach to the knee and everything like that. It's just a matter of when we go to cut the bone, it takes the human error out of that. It also gives us much more information going into the case as far as what we're going to need during the cases, what possible problems we may encounter, and it really makes the knee a much more normal knee if there is such a thing for a total knee arthroplasty. The current research that we have at this point does show that people tend to recover a little bit quicker. Postoperative pain seems to be a little bit less. As we do more and more of these and spin out for longer and longer, hopefully we'll gain more information on that.
Thinking about the people here, first of all, I really feel like they're genuine and they're caring. I do feel like we can trust them. As we've been here and the things we've asked, the questions we've had, been very, very helpful to us.
They've went all out for us. I mean, they've helped us everything we needed.
They treat each patient individually. They care about the patient from the time that they walk into the door to the time that they walk out of this place. They truly put effort into making them have a memorable experience as far as having the best care here at Wayne Healthcare. Our goal is to make this a destination for orthopedic surgery, whether it be upper extremity, total joints, anything along the orthopedic service line. We're trying to make it an orthopedic destination.